Hi guys, it's Shay. Quick note, excuse the really bad henna. It's gotten to that stage where it just doesn't look as nice anymore, so it kind of looks like really gross. Just ignore that. Anyways, I've gotten some emails from you guys. A couple of you have been emailing me to ask me some questions, ask me some advice. You know, a couple of you aren't sure if you have Kienbocks disease, but you know you're suffering with a lot of pain and you're having a really hard time and your doctors aren't necessarily very helpful. And you're looking to get some advice from someone who's gone through it. And I am so glad that you guys are coming to me. I love helping you, and I am definitely here to answer any questions you have, or maybe just kind of give you some examples of what I've been through that maybe you can relate to and to maybe help you. But one thing I want to say that's very important is I want you to trust your doctors, but I also want you to kind of keep in the back of your mind that a family doctor is not necessarily going to be able to diagnose you with Kienbocks disease. And the reason why I say that is because when they're going through schooling, they have to learn a vast amount of different types of conditions for different parts of the body. There is no specializing or focusing on a specific area of the human body. And because of that, their knowledge is also quite limited. So even though it's a vast knowledge because of the different things that they have to learn, it's also very limited because they might be able to diagnose carpal tunnel and tendonitis and maybe some other conditions in the wrist, but Kienbocks is a very specific and very rare condition. And that makes it a lot harder for a family doctor who hasn't gone through that extensive studying in school to specialize on that area of the body, is not necessarily going to know that condition or other conditions that are similar to it. So even though you should trust your doctor, I also want you to keep in mind to get a second opinion from an actual specialist, so a hand specialist or hand surgeon. Find your time in your busy schedule to make an appointment with one. You know, look up on Google for one in your area, do your research, but make sure you get that second opinion, because I went undiagnosed for a very long time, which made my condition more of a worst case scenario. So in my other videos, I kind of explained what I went through. So you guys know that I had a harder time. I've had 2 surgeries instead of just the one. My hand is not 100% and will never be 100% the way it was. In fact, I've lost about I think I've lost about half or more than half of the use. I can still do a lot and I can still take care of myself, but I have limitations now. Compared to if I had been diagnosed earlier, I would not have the limitations I have now, and I would have had more use in my hand and probably less pain as well, and maybe not as many extensive surgeries that I've had. Anyways, so that being said, I want you guys, so I'm going to put this out there. I don't want you guys just thinking that you have a couple of the symptoms that I've listed in my other videos and think, oh my God, I have Kienbocks. I don't want you guys panicking and working yourself up before you see somebody to get that second opinion or that advice from a doctor on what you may or may not be dealing with your wrist. Not everyone who suffers with a very large amount of pain in their wrist is going to have Kienbocks. It could just be a very severe case of carpal tunnel or a very severe case of tendonitis. Could be a sprain, could be a break, just depending on the situation. I want you guys to ask your family doctor for X-rays and MRIs. I definitely would say MRIs is most important, and the reason why I say that is because X-rays show bone, but MRIs kind of have a larger picture that can be shown. So it's not just bone, it's also nerve and muscle and tissue and all that kind of stuff, which is a lot more important because seeing a better picture of the area can actually give them a better diagnosis. I had multiple X-rays, and they saw something that just wasn't right, but they weren't sure until we got the MRI, and then they realized really what it was because they could see the lack of blood flow to the wrist, which would explain the damage to it, which kind of gave a better, more information to diagnose. So, so these are the couple things that I want you to remember. Yes, do your research on your symptoms, just so you can kind of get a better idea of the types of things that you may or may not be dealing with, so that you can help your doctor diagnose you, because sometimes they don't always know how to diagnose you. So that's the first thing. Second thing is, don't be afraid to take care of your wrist. And so, which means relax it. If you're noticing that you're having a lot of pain at work, find things that can help you lessen that. So maybe doing things differently, maybe talking to your employers and saying, look, something is different, something's changed with my wrist. Is there any way that I can just do things a little lighter, get a little more help? Do you mind if we look into getting a couple things for my desk that may help me relax a bit more? So that would be a mouse pad with the bump on it, so that you have something to rest your wrists on, or that strip that goes in front of your keyboard so that you can rest your wrists on. Those kinds of things can really help you in the long run. So don't be afraid to talk to your employer or your workplace and just say, this is the situation. It may just be overuse, but do you mind working with me to help me? And putting heat on it, putting ice on it. Two things. This is what I'm going to lead into next, but two things. If you're going to put heat on it, put heat before you do something. So say you're going to do a lot of cooking. Put heat on your wrist before you do the cooking, and put ice on your wrist when you're finished. And the reason why is because the heat helps relax the muscles so that you don't injure yourself further while you're doing any types of strenuous activity. And then the ice kind of helps tighten everything up and helps any sore muscles feel a little bit more relaxed and kind of helps them feel better. It helps also inflammation, because when you do things with your wrist, it will inflame. And then the last thing, like I said, just look into specialists, get the help and get the advice that you need. Don't always rely on your family doctor for everything, because like I said before, their knowledge is a lot limited. Okay, so a couple things that I wanted to lead into, and I might do a second video if I run out of time. I mentioned before, beanbag pillows, very, 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 very important. And I said before in my other videos, it's because it molds to your wrist and it helps with stiffness and it helps get it comfortable. Another thing is when you're sleeping, a lot of people kind of have been expressing to me that they're having some issues with numbness and tingling. I went through that. Now, numbness and tingling, the tingling kind of feels like pins and needles, like if your foot falls asleep. That's kind of the, not worst case scenario, but that's more of a worse example of it. So a lot of people have just a little bit of tingling, and others have the pins and needles, and then they get numbness. And I found that I'm not sure exactly, so don't quote me on this, but I've noticed that I think it's when I'm sleeping and my arm is above my heart, it helps with numbness and tingling, when it's raised. So make sure it's raised above and it's on an angle. Don't this while you're sleeping, because that's just really uncomfortable. But raise it above your heart, kind of raise it on an angle. Another thing is get those spongy exercise balls for helping grip and dexterity and strength. It kind of helps you build it up again. I recommend this after, when you're recovering from surgery, if you have Kienbocks. Another thing you might get from your physiotherapist or occupational therapist after surgery is you might get putty. Now, putty has different colors. This is the Flex Grip Exercise Putty brand by Elgin. There's different colors. Each color goes up in firmness. So your softest one is going to be tan and yellow. Tan and or yellow. Those are the two colors that are the soft. And then the green and blue are both firm and medium firm. Red and coral, which coral is what I have, which is medium. I worked my way up to coral. I started with yellow. And will gauge which one you need depending on how your wrist is healing or your hand is healing. Now I am running out of time, so what I'm going to say before I go is definitely, actually I'm going to do one more video about massaging your wrist and how to take care of your wrist. But yeah, so basically, just like I said, take care of your wrist. Don't be afraid to not to take rests and take breaks, and don't be afraid to ask questions and research. And sometimes we have to self-diagnose, and sometimes we have to kind of self-research of what we're going through, because sometimes doctors don't know different types of diseases and conditions because their knowledge just doesn't go that far. And that's okay. That just means that we need to see someone who does have that knowledge. So if you guys have any more questions about just diagnosing yourself and helping you kind of that way, send me an email. My link will be below. See ya.